Okay, I think we're probably about ready to go. If everything has worked well, we should now be live streaming the internet for a meeting in public of South Tyneside CCG governing body. These meetings occur every 2 months and are the senior meeting of the body in charge of commissioning healthcare for the people of South Tyneside. We have a number of new faces around the table today, so particular welcomes to Neil O'Brien in his first governing body meeting as accountable officer of the organisation, to Louise Lydon, the primary care representative around the table, and to John Whitehouse, who's the new lay member with responsibility for audit governance and the conflict of interest guardian for the organisation. What we'll do is we'll go around in turn and I'll ask each person on this remote meeting to introduce themselves for anybody who is watching, so that we all know who everybody is. So I'm Matthew Walmsley, I'm a GP in South Tyneside and chair of the governing body and have been for a number of years. I'm just going to move down my list here. So Matt Brown.
Morning, my name is Matt Brown. I'm Director of Operations here at the CCG in South Tyneside.
Tarquin Cross.
Hi, I'm Tarquin Cross. I'm a consultant geriatrician. I work at North Tyneside General Hospital and I'm the secondary care clinician on the governing body.
Tom Hall.
Hi, I'm Tom Hall, the Director of Public Health for South Tyneside.
Keith Haynes. Is Keith there? Disappeared. Ah, he is.
So I'm Haynes, the governance and staff CCG.
Okay. Kate Hudson.
Hi, I'm Kate Hudson. I'm the Chief Finance Officer and Chief Officer for the CCG.
Louise Lydon. Oh, you might want to unmute, Louise. Yeah.
Good morning, Louise Lydon. I'm community pharmacist, contractor in Jarrow, and I'm a member of the governing body. Thank you.
Neil O'Brien.
Yes, hello, I'm Neil O'Brien. I'm the accountable officer for the CCG.
Pat Hall.
Good morning, Pat Hall, lay member for the CCG.
Paul Cuskin.
Hello, I'm Paul Cuskin, a lay member for patient public involvement and also chair of the patient reference group.
Helen Ruffle. Is Helen on the line?
Hi, sorry, Matthew. Hello, I'm Helen Ruffle. I'm the operations manager at the CCG.
Jeanette Scott.
Good morning. My name is Jeanette Scott and I'm the Director of Nursing, Quality and Patient Safety at South Tyneside CCG.
Vicky Patterson.
Good morning, I'm Vicky Pattinson, Head of Adults and Integrated Care at South Tyneside Council and Interim Head of Joint Commissioning for South Tyneside Council and South Tyneside CCG.
And John Whitehouse.
Morning, I'm John Whitehouse. I'm a lay member for audit and governance and I'm also the conflict of interest guardian.
Thanks. Also on the call, we will have Jane Layton, who's taking the minutes for us today, and Lee Hogan, who's organising all of the technical aspects of streaming this and making sure everything runs smoothly. Can I remind all the participants in the meeting that this is a meeting in public and is being streamed and is being recorded, just so that you're aware of that. Can I ask people to keep their microphones on mute if they're not speaking in order to minimise feedback for participants watching? Can I ask people if they wish to contribute to the conversation to initially indicate that to me by turning their microphone off? I'll try and bring them into the conversation as required. And can I ask that people try to avoid using the hands up sign of Teams, as that does cause some issues for people watching online when that happens. Do use it as a last resort if there's no other way of attracting my attention by turning your microphone off, coughing and waving in the old-fashioned way, though, if needs be. Okay, can I ask anybody for any declarations of interest that need to be made? I think it's worth noting, everybody out, that a number of people have standing declarations in terms of myself as a GP in the borough, Louise as a pharmacy contractor, Tarquin's role as a consultant in a neighbouring trust, Neil's role as a GP outside the borough and as accountable officer of 2 other organisations, and Pat's role on the governing body of a neighbouring CCG and John's role on the governing body of another neighbouring CCG. Those are the substantive ongoing declarations that we make. I couldn't see anything specific when we went through the agenda on anybody else, any other declarations that need to be notified. Anybody got anything they need to tell me about? No. Excellent. In that case, can we move straight on to the draft minutes of the last meeting that we had back in March? It seems a very long time ago now, and we'll take those for matters arising and accuracy at the same time, page by page. So page 1. Pat?
Yes, thank you, Chair. Just to remind you that I was actually did attend the meeting, but we had a lot of problems with technology. And so I had to send in by email all of my comments and queries via email to Matt.
I'm glad we've got those fixed by this time, so we'll amend the minutes to reflect that.
Thank you.
Anything more from page 1 and page 2? Page 3, page 4, 5, just checking how many pages we've got so I don't overshoot. Kate wants to come in there.
I'm just getting ready for page 6, actually.
Oh, right, well, page 6, we'll go on with Kate then.
So it was just, and I'm sorry, I'm just trying to scroll through and find it myself. It was a draft budget brought to the March meeting of the governing body, and it was indicated that we'd bring a full and final budget to the May meeting. If you don't mind, I'll pick that up under the financial management under pandemic item, because we haven't been able to do a full and final budget. So I'll come back to that under my item on the agenda.
Okay. Anything more for Paul? Sorry.
Yeah, item 136, page 6, bottom of the page. Could we have an update on the end of life strategy?
Yeah, Matt, do you want to comment on that?
Yeah, so as you'll note from the minutes, we intended to have a progress report coming to this meeting. Unfortunately, we've not been able to move that work on as we'd anticipated, with everyone's efforts being focused on the COVID-19 response between March and May. So I'm really sorry to that. I know that there were lots of people anticipating that piece of work. We will have that paper for the July meeting of the governing body, and we'll be able to give a full update and progress report on where we're up to with that piece of work. I'm sorry about that.
Okay. Anything more from page 6? And page 7. Okay, so we shall call those minutes as an accurate reflection of the meeting. Excuse me, other than the corrections made for Pat's attendance. Okay, the next item on the agenda is question time from members of the public. Now, we don't have the facility to take direct questions. We have received some questions by email. I'm proposing that we address those at question time at the end of the meeting, as there's a number of those questions that might be addressed by discussions that take place during the meeting. So anything that isn't, we'll pick up at the end. Can we then move on to the next item, being the Chief Exec's information, and Neil, and there's been a report produced. So Neil, over to you.
Thanks very much, Matthew. So the report that I've enclosed just gives a brief kind of update on any national matters that might be of interest to us locally, and also any regional meetings that I have attended on behalf of South Tyneside CCG. I don't intend to go through it in any great detail. I would expect in future governing bodies it might be a little bit fuller, but my entire time has been taken up with COVID. But I believe the style that the previous accountable officer was given, I don't think did a full report like this. So as part of at the end of the questioning, I would appreciate just some feedback on whether or not this is too much detail for governing body, or if you like to have this amount of information, it can be a lot more condensed than it is. But certainly when I've done this in other CCGs, I think it's useful for governing body members to see the headlines of where I've been at and what's been happening, and then you can read further detail if you want to. So I'm happy to take any questions from governing body.
Okay, a quick look at who's trying to speak. Who's trying to speak there? Who's got a question for Neil on that? Surely, Pat.
Yes, thank you, Chair. Thank you, Neil. I thought it was an excellent report, very comprehensive, and I certainly would prefer that we continue with this process. It certainly gives a really good overview of what's happening and what you're involved in. If I may, and it might be that someone else can answer this question, but I was very interested in the Section 6, supporting people with long-term conditions in South Tyneside. It's certainly something going forward that we need to have real focus on. And I know that we mentioned that in one of the papers later on in the meeting. But I just wondered, there's been a lot of work gone on, and I just wondered if we'd had any feedback from patients themselves regarding this.
Matt, do you maybe want to answer?
Yeah, I'll perhaps start on that, and maybe that Tom wants to give a view on some of that as well as we get into it. But clearly the long-term conditions item has been a real plank of our work for the last couple of years, a real priority area. So you've got quite a comprehensive report in Neil's update. I think as we're going through, and you'll see in the COVID recovery paper later on, we're collecting views from clinicians, members of the community, voluntary groups and patients about their experiences over this period of time, in terms of what they've liked, what they've not liked, what we want to keep and so on. And I think there's a real mix of views, but there are things that are really people have found very beneficial. So the access to GPs, for example, through video consultation allows a different way of managing conditions, challenges with social isolation. But we're in the process of capturing all that information and making sure we turn it into a really crunchy action plan that supports long-term conditions and our other priority areas. I don't know if Tom wants to add to that.
I think that's a good response, Matt. I think the only thing I'd add is that, you know, there have been some really beneficial service developments through this period of time, and you know, a constant reflection here is when we're talking about moving forward, are we going back to where we were, or are we genuinely going to move forward and start to build on the models that we've started to develop? And I think there's a real opportunity for us to do that. And I think the long-term conditions strategy group has arguably been at the forefront of that as well. So I think the work that Dr. Dave Julian's been leading with others who are on this meeting today and partners across the system, including the voluntary and community sector, has been really, really powerful. And I'm looking forward to see what service models we continue to support and develop.
Good. Thank you.
Yeah, and then Jeanette, and then back to Neil. Do you want to wave, Jeanette? No, sorry, that was just a random wave. Paul, and then Neil.
Yeah, item 4, the care homes. I want to comment on that, but can I pick it up under the next item, under the COVID update?
Of course, yeah, we'll put that up under COVID. Neil, anything further reflections there?
No, I think just a reflection on, I can give my experience.
Oh, you're quite quiet there, Neil.
I can give my reflections from working across CCGs. There certainly is a very joined up approach to considering how to manage long-term conditions in South Tyneside, and that is evident. I think other areas could certainly learn from that. And morbidity clinics are a really interesting concept. So I would be keen to push that forward. But yeah, just the report's there, and I'm happy to take email or a further chat later on if needs be.
Thanks very much. I think people have appreciated the length of the written report there, Neil. So great, we'll note that for the minutes. Let's move on to the next item then, which is the Key Assurance and Risk from Quality and Patient Safety Committee, and Jeanette.
Thank you, Chair. So this is the usual update that I give at every governing body. as you would expect, it's slightly different this time because of the COVID-19 pandemic. And due to that pandemic, some things have had to change in terms of our usual processes around monitoring of quality assurance. So what we've done is we've continued, organisations have continued internally with their usual processes, but we've had dialogue with providers around anything to do with any quality concerns. They've continued to register any serious incidents in the same way, but some things stopped. So friends and family tests, for instance, nationally it was agreed that could stop during the pandemic, and as yet we haven't been told that they need to start again. In terms of the meeting processes, the quality review groups, we changed the format to just an assurance process rather than hold the formal meetings. But that's going to change, and we're going back to holding the full assurance meetings, the full quality review groups in the next meetings. But in the interim, just to assure the governing body, we have still received information from providers, and we've monitored quality and received assurance from all providers. In terms of primary care, we've been working with colleagues around developing a quality assurance sit reps around how practices, as they're going back to business as usual, are going to manage cohorting of COVID and non-COVID patients potentially when they're seeing them in the practice, and how practice staff might need to change the way they work in order to protect themselves and protect others. I thought it was worth mentioning the mortality at South Tyneside and Sunderland Foundation Trust. Just to highlight, we were aware that it was identified that the trust looked like they were an outlier, but there's been a huge amount of work undertaken. The trusts have undertaken a huge amount of work reviewing any mortality that has happened within the organisation, but also they've had external scrutiny. And actually we've been invited to an event, a learning event, at the beginning of June, where they're going to present all of the findings, and they've looked at multiple different factors, including things like deprivation. So I think it sounds, I'm really interested to hear what the findings are, because it sounds like it's been a really comprehensive review that's been undertaken. We've been assured by the early feedback that we've received from that internal review that there was nothing that indicated that there was anything of concern. In terms of infection prevention and control, in response to COVID, we have brought in some specialist resource from South Tyneside and Sunderland Foundation Trust to support care homes, and that's still in place and ongoing, and we're looking to the future to embed a similar resource to carry that work ongoing. PPE, I don't think anybody, you can't not mention PPE when you're talking about COVID, because it's always on the horizon somewhere. We've actually been quite fortunate in South Tyneside. We've managed to keep the supplies going. We've had good processes in place. We've had good mutual aid where it's been required. We have got a hub set up in, it's actually based in Sunderland, and that's mutual aid that can support organisations in an extreme emergency when everything else, every other route's been explored. And there's an indication that that might need to continue for a short while yet. So those conversations are ongoing. And I believe that there might be some new guidance published. We know that as services start back up again, and also that some of the relaxing of the measures in place around self-isolation, but also social distancing, there might be some changes, particularly I'm thinking around the wearing of face masks. So we're watching very carefully around what the guidance is around that. Care homes is covered, it has been covered in the previous paper, but I just wanted to, to reinforce that there's an awful lot of work going on supporting care homes in South Tyneside. We've had some excellent feedback as a team of organisations around the care homes feeling supported. It obviously has been a very busy time for them, but we have attempted always to be very responsive to any needs that they might have, and that's continuing. And that the process we're delivering infection control training to every care home in South Tyneside. By next Friday, the 29th, we have a target to have trained every single care home, 100% of homes by next Friday, and that's something that is ongoing at the moment. And I think the only other thing that I would mention is just around safeguarding in general. We are obviously concerned about the potential for hidden harm during this period of lockdown. Services are expecting to see a spike in referrals for both adults and children. At the moment, we're not seeing that, but we need to plan for the potential for that. And we're having conversations at the respective safeguarding boards as to how we might plan for that. The type of things that they're very conscious of. For adults, it's domestic abuse and also radicalisation online. But also for children who aren't at school, the potential for harm when they're not as visible as they normally are in a number of settings. And so we're considering including on our CCG risk register planning for what potentially is an increase in referrals for both adults and children. And I'm happy to take questions.
Thanks, Jeanette. People with any questions for Jeanette? Just looking through the microphones. Paul, yeah.
Yeah, Jeanette, that was really interesting. Just want to make a comment on the care homes. We've got some remarkable and passionate patient stories for people who sadly passed away in care homes and their families, given the COVID restrictions, couldn't be there. So the care workers were sat with those people who've been dying. And I know it's like Mental Health Week. What resources or what support can we put into place for those care workers, particularly in care homes, to help with mental health issues?
We already have support in place. Actually, we've already circulated a lot of resources to care homes, and that's for either relatives, for staff and other residents, actually, because this is people's homes and they're a community within a building, and a lot of people have lost friends that they've known for a very long time, and so that's already in place. There's also plans around the IAP service, so that increasing the referrals, so that's already going to be available, and the First Contact Clinical have made available some really useful online resources. So there's been a lot of support and materials made available. But also what I would say is that the team who ring the care homes every single day have really good relationships with the care home managers. And that's the place where they're more likely to expose, if you like, that there's problems and seek help, rather than in bigger forums when there's lots of people join in a meeting forum or whatever. And I'm confident that the officers who do have those relationships are exploring and opening up the conversation to check that there's that the needs are being met. If there's any other resources required, obviously we would be looking to try to support that. In terms of actual residents, there's also additional resource focus being put around people with dementia. So the Cumbria, Northumberland, Tyne and Wear services have been more visible and being supporting care homes where that might be an issue, because some of the restrictions that have had to be imposed have been very difficult for people with dementia, especially where they tend to wander quite a lot, and if they're being restricted into certain areas, could be quite distressing for them. So there's a whole raft of support across the piece for residents, for relatives and for staff.
Thank you. Okay, I'm aware that the next item is COVID response, and we're in danger of morphing the two into one by expanding this discussion much further at this point. So can we note Jeanette's report, and thanks to Jeanette and the team for their part in the COVID response, and we note the ongoing assurance for the work that's been done at the providers that we commission. Thanks very much, Jeanette.
Would you mind if I just gave a shout out? There's lots of people who've been working extremely hard, but Kirsty Hesketh particularly around a lot of the work around both the PPE and the infection and prevention and control. She's been pivotal to getting everything in place and keeping things moving. And I don't know how I personally would have managed without her. And I just really wanted to make a note of my thanks to her for the work that she's put in. She's not the only one, but I wanted to personally thank her.
Should certainly record the hard work being put in there, and record the thanks to the whole governing body. If you could convey that to Kirsty, that would be great. Thanks very much, Jeanette. Right, let's move on then to the next item on the agenda, which is the update on the COVID-19 pandemic. This would normally be the performance part of the meeting, but the NHS performance has really shifted into concentrating on one thing in the last few months. So Matt Brown, when you took on the role of Director of Operations with responsibility for emergency planning, preparedness and response, little did you realise that this would be what your life would be over these 2 months, but over to you, Matt.
Yes, global pandemic wasn't an explicit part of the job description, but it's there somewhere, isn't it, I think. Okay, I'm going to take you through the paper. So normally I would just touch on small elements, but given the way that the structure of the technology is going to work, I'm going to talk you through quite a lot of the detail. I'll try and reference you to the page I'm taking you through. We have covered some of the content already. Jeanette's given a really full update, I think, on where we are with care homes. So just to preface this, I think if I take you to page 21 of the pack, which is page 3 of the paper, so page 21 of the total governing body paper pack, I think I'm going to show you some slides about the local context. I think it's really important just to recognise that this paper is a bit of a snapshot in time. So things are moving so quickly, and the data we're receiving is changing very rapidly. So some of this will already be slightly out of date, but it is where we are at this point in time. Now, if the technology works, I'm going to attempt to share some slides with you which represent the charts on the next few pages of the paper. We've included one further chart which Claire Bradford, the Medical Director at Sunderland CCG, helpfully shared with us and with the governing body on Tuesday, which relates to mortality at STSFT. So hopefully in a second you will see the slides appearing on the screen. I hope everybody can see those slides. Yes, thanks, Matthew, I can see. Okay, so I'm going to start with that first paper, which is about the crude positive case rate for COVID-19. You'll note that the date at the top, this is up to the 10th of May 2020. Clearly 10 days have passed, a lot of things have happened in that time, but this is it is where we are. You'll see South Tyneside highlighted as the orange column, and you'll see we're amongst the highest in terms of the case rate in the region, alongside Sunderland and Gateshead, and very similar to Middlesbrough. I think, and Pat and Neil will have heard this from Claire on Tuesday at Sunderland, there is a reality here that the more tests you have, the more cases you have. So I think we have to be a bit careful about the use of this information. And the reason for putting it on the agenda today particularly is to give us the opportunity to talk about the context around it, because it is being nationally reported in some of the media, but without necessarily understanding some of the limitations. So this is the number of people who've tested positive. That is not the same as the underlying prevalence of disease in the community. So that, as I said, the more people you test, the more people you will find, the more positive cases we will find. And it probably is a fairly unreliable measure of the underlying prevalence. When I get to the end of the presentation, I'm sure that Tom will want to comment on that as well. In particular, The age of the population that you test is important. So if you have an older age profile, this is a crude rate, it's not weighted, you're more likely to find more positive cases. Where there are more people in hospitals and care homes, you're more likely to test, more likely to find positive cases, again, age related. The sensitivity of the test we use in terms of how many true positives are found is really important. So South Tyneside, Gateshead and Sunderland all use the Gateshead lab, excellent facilities, a really high level of sensitivity. So it may be that actually some of the higher level of case reporting is actually due to the sensitivity of the testing. But probably the most important factor in delineating between the areas is the reporting of Pillar 2 testing. So Pillar 1 testing is the local lab reporting. So that's where we've set up services really quickly at the start of April to report on COVID positive tests. Pillar 2 testing is the national testing, the national labs where there's one at Gateshead, IKEA currently. Now, up until now, the Pillar 2 testing, which represents the majority of activity, is not reported by local authority. So the positive case reporting is where you've had a local test in a local facility. So those tests have been reported in the Gateshead lab, IKEA, have been taken in the Gateshead IKEA, are not included in these figures. Now, the reason that's important for us is us, alongside colleagues in Sunderland, for example, set up very efficient, effective local testing facilities. We've had lots of care home staff, we've had lots of local healthcare staff coming through that facility. So it is likely that the other areas have actually used the national testing more than us, and therefore actually there's a bit of an imbalance in terms of the reporting. So we're not reporting the true figure probably for other areas. So I've put this up because I want you to treat it with caution. It is an indication of something and no more than that. I'm going to cover this slide very quickly. This just gives us an indication that comparing the 7 days up to the 10th of May with the preceding 7 days, there's been a significant decrease in the number of confirmed COVID cases being reported. It is likely that as we really increase the testing nationally, we'll start to see that change, but I thought it was just useful to show that actually the number of positive cases being reported is decreasing on a weekly basis. This third slide is not within the paper. As I say, this is a slide that Claire Bradford helpfully shared with the Sunderland governing body on Tuesday. This is by Foundation Trust on the vertical axis, the deaths per COVID patient, and on the horizontal axis, the number of cases in hospital. You'll see, I hope you can see my cursor on screen, that South Tyneside and Sunderland is this little blue dot here. The key point about this chart is that, Jeanette talked earlier about mortality, is that the blue dot is within the yellow lines, which are 2 standard deviations from the mean. So that suggests that the mortality in South Tyneside Sunderland Foundation Trust is not different to what you'd expect, excepting we've got a global pandemic. Now, clearly, every death is a tragedy in its own right, but as a governing body, we have to look at the statistics strategically to understand whether there are issues we need to be concerned about. And this suggests it's within normal bounds. Perhaps a more useful measure is this one, which is the age standardised mortality rate. So this takes account of the age profile of the population, allows us to make some useful comparisons. You'll see that the COVID mortality rate is in orange along the bottom, and the overall mortality rate is the total, which is the blue. So the reason we've included both is there are some limitations in how many deaths are actually reported as COVID related deaths, but also the indirect consequences of mortality. And you'll see that South Tyneside, the confidence intervals, which is the little black line, are not particularly different from the northeast in England, but perhaps different from some of the areas which have had slightly higher levels of mortality up to this point. I would just stress that this is from the 1st of March to 17th of April. So this is a little bit old, this data now, and we'll have to see how that changes over time. But this is probably a better measure of what mortality from COVID and the indirect consequences of mortality are. And finally, before I go back onto the paper, I think this is a really important slide. So what this shows, and it's important to stress, this is national data. This is not South Tyneside data. We don't have sufficient numbers for that at this point. This is for the country as a whole. From the left to the right, these are deprivation deciles. So those people in deciles 1, 2 and 3 are the most deprived in the country. In 8, 9, 10, the least deprived. So what this shows very clearly is that the impact of COVID-19 is not felt equally. It is the burden of disease and mortality is greater for those who are more disadvantaged and more vulnerable in society. So as we plan our response and as we plan recovery and moving into our new future, we really have to be mindful of the consequences that will not be evenly felt. If it's okay, I'm going to carry on working through the paper and perhaps come back for questions at the end. So I'm just finding my place on the paper, if you just excuse me. Okay, so if I take you onto page 6 of the paper, which is page 24 of the total pack, section 3 on governance. So we've talked a little bit about this in some previous meetings. We established an incident control room under my leadership as the Accountable Emergency Officer, with daily executive meetings and weekly silver meetings to allow us to decisions and move things forward at pace. At the top of page 7, our partnership arrangements continue to be extremely important for us. So the Alliance Business Group, Alliance Leadership Team, and our individual alliances, long-term conditions we've talked about, continue to meet virtually and continue to make decisions about how we move things forward. And we link with partners through our surge calls. Jeanette's already touched on the daily and weekly calls with care homes. And we're having daily bulletins to our primary care colleagues, including a weekly GP webinar, which has proved very helpful. At the bottom of section 3, you'll see there we took some decisions about amending the standing orders for the period of this COVID response to allow us to make sensible decisions. Tom and Vicky may want to comment on some of the elements in section 4. So the support hub, which has provided food, medicine and wellbeing support for our residents. And I did want to point out the hashtag Proud to Support campaign, which is under the hashtag Love South Tyneside banner, where we really want to celebrate all those who've played a part in the COVID response so far, not just our really important health and care staff, our care home staff, but also those volunteers, third sector organisations, the delivery drivers who kept our society going. So we really do want to make sure that people celebrate those. You'll find that on Twitter. In terms of section 5, primary care, which is page... Yep. No, I've taken that off, Lee. The presentation element's finished now. I'm just working back through the paper. Thanks. So in terms of page 7 of the paper, we're working through primary care has changed very dramatically. So face-to-face consultations were the dominant mode of contact previously, and we've moved that very much to being almost entirely video call and telephone led. And I do want to note the work of the primary care network clinical directors and our CCG clinical directors, so particularly Angie Curry, Dave Julian, John Toes and Jim Gordon, who've really driven change in primary care very rapidly. So at the top of page 8, we're talking a bit about the Red Hub established in Stanhope Parade, which we've now stood down for the time being, but is able to be stood back up if needs be. And the SAT squad, which has allowed us to get monitoring equipment out very quickly to patients and has proved really successful. Health Pathways continues to be a vital mode of communication for us with our general practice colleagues, and our community pharmacy colleagues have done an excellent job, and I particularly noted the introduction of the 24/7 pharmacist and the increasing availability of palliative care medicines, which has been really important during this period. On section 6, I'm not going to go through the entirety of the hospital care elements, but I do want to draw your attention to the fact that, on 17th of March, we were instructed to implement a series of interventions that allow us to deal with the anticipated intense pressure. So the establishment of the Nightingale Hospital, but also freeing up as much inpatient capacity as possible within the hospital. So that has meant postponement of significant amounts of activity to allow staff to focus on COVID patients. And we will at some point have to, when we come on to the next paper, we'll talk about how we're going to start to reactivate that activity and think again about the fact that the consequences of that will not be felt equally across our populations. On page 10, there are some numbers which just reflect the changes you'll see in South Tyneside Hospital over the last 6 months. So we've seen markedly less A&E attendances, and we've really helped to discharge people into home and care homes for some of our long stay residents, as you'll see from that table on page 10. I want to touch briefly on mental health, which is in section 7. And we really are, I was going to say fortunate, but actually a huge amount of work has gone into getting really proactive mental health services across the life cycle in South Tyneside over a number of years, and that's really come to the fore during this time. So we've got very targeted and directed self-management tools. The life cycle service has been working very proactively across the borough. And if I take it down onto page 11, the counselling and bereavement support, and particularly the work with our SEND children to make sure that they're really well supported. We've touched on care homes, and I'm not sure there's a great deal more for me to say other than what's in the paper. Other than I think these are extremely challenging times. We've had to be very fleet of foot in thinking about how we support the expected activity and pressure from COVID. And I really do want to pay tribute to Jeanette Scott, our Director of Nursing, Jim Gordon, Sam Batson, our GPs, working with Vicky and Public Health, who've really provided an excellent support team wrapped around our care homes. I think I'll move us on to the summary at this point. So you'll see we've made a significant number of changes, and I think as we get into the next paper, we need to really think about the potential consequence of that. So we've dealt with the first peak, but what we have yet to see is the impact of the delayed care on some of those individuals, the changes to health-seeking behaviour, and the economic impacts on health well-being. We will have to work through those as time goes on. So I'm asking the governing body to firstly note the contents of this report, as you'll see on page 14. But secondly, I really do want to acknowledge our staff, our residents, our patients, our volunteers, our elected members, who I think have done a fantastic job complying with very difficult social distancing and social isolation in very challenging circumstances, and really going above and beyond the call of duty during this pandemic. And I think on that note, Matthew, I'll pause there.
Okay, thanks very much, Matt. We'll certainly note the response and the huge amounts of work from a lot of people. Excuse me, within their jobs. This is dry throat, not new fever. Don't worry. And the thanks that really the health community owe to the whole community for its response to coronavirus and COVID. Give the opportunity now for colleagues to make comments or ask questions on the paper. And I think Paul wants to come in.
Yeah, thank you, Matt. It was really a powerful paper, particularly the statistics bit. I think the difficulty with the statistics is it's so difficult compiling tests when tests haven't been sort of carried out as much as, say, Germany or any other countries. But what we should be looking at is trends. And it's not new to us, is it? Areas where you've got multiple deprivation is going to be hit widely by COVID. But I think the real point I wanted to make was at the beginning of this week, the Swedish government apologised to its residents for not protecting the elderly. And I recognise that with our care homes, and I acknowledge everything that you've said about the staff in healthcare, frontline, domiciliary care workers, the care workers who are doing extraordinary things where they've never really had the capacity to do it. And then they're coping with huge, significant numbers of COVID patients going into care homes. And that was at the cost of protecting the NHS, which is, in my opinion, a flawed strategy. Because the difficulty I have is if you've got 70% capacity free within the NHS, and the mantra is to, discharge people into care homes who've got COVID or asymptomatic, then the issue is, shouldn't we be using those facilities and Nightingale for people to convalesce from COVID, recover from COVID? And I think the real issue that I have is we put very poorly people amongst the most vulnerable people in society.
Yeah, I mean, I certainly think I agree. This has been an extremely challenging time for everybody. We've worked extremely hard to follow national guidance and to anticipate the likely intense pressure that was going to come on the NHS, and equally to work very closely with care homes to make sure that we provide as much support as we possibly could to them. So I certainly couldn't pretend it's not been a challenging time, and I'm sure that some mistakes have been made along the way, but certainly I'd like to assure the governing body that we've done everything we can as a partnership to support our vulnerable residents, the elderly, and our care homes.
Perhaps it's an opportunity for Tom or Vicky and then Jeanette to comment on the response, the joined up response to across to care homes.
Yeah, I mean, and I think Vicky's probably best placed to give more of the detail in terms of how that support has been working with care homes along with Jeanette, because it really has been a team effort to try and wrap around care homes. I mean, I agree with Paul's point that, care homes in particular have had to face an extremely challenging and novel situation to them, as we all have, but it's been faced even more in the care sector. I think the way that we have wrapped around care homes has shown true partnership working and has has been a really commendable model. My thoughts turn to how we sustain this for a period of time. This is not a pandemic that's over, not by any stretch of the imagination. We're in this for a long haul period of time, particularly with our older and more vulnerable sectors of the population. So we need to very much turn our attention to how do we keep this support going? What does it look like from a partnership perspective? How do we ensure that the resilience and the capacity is there in the care sector for the long haul? Because I think we're hitting a point where a lot of staff and managers of these services are starting to run on empty. You know, this has been a very challenging time, so we need to turn our attention to protecting those and creating the resilience in the sector.
Vicky, and then maybe Jeanette.
Yeah. So I mean, I would just say and echo both Tom and Matt's points in terms of the strength of our partnership working in South Tyneside. What I would point out is I would like to think that we were ahead of the curve in South Tyneside. So a lot of the national requirements now in terms of the care home support, we had a lot of those things in place already in South Tyneside. So we already had our care home support team in place. So a lot of, as I say, the national ask, we were very confident and we already had a lot of those things in place. So I'm pleased to be able to say that, you know, we were ahead of the game, if you like, in terms of how we were supporting our care homes. And that is because of the strength of the partnership working. As Jeanette's already alluded to, we've got daily calls in place with our care homes. We've got good relationships. We understand what's happening within our homes. And we've had some really positive feedback from all of our providers, both domiciliary providers and our care homes. But that doesn't, you know, take away the fact that they are dealing with some really challenging situations. And as Tom points out, it is about how we then think about how we keep this going, because, you know, this is going to be a situation we're dealing with for a significant length of time. And it's just thinking about how we keep this sustained for a significant length of period now, I think.
Thanks, Vicky. Jeanette?
Yes, thank you, Chair. Very briefly, I just want to assure the governing body members that these issues are front and centre of our conversations on a daily basis. We're aware of what the challenges are. We're doing everything we can to support care homes as a system, and that includes the trust in terms of community services. We can't put our hands on our heart and say everything's perfect. It's never a perfect system, but we know what we need to do and we're working on it urgently. So I would just want to give assurance that we do know what these challenges are. We empathise and sympathise with the care home staff and the residents, and we are taking every action we can to address what the issues that they're living with on a daily basis.
Okay, and we've got Pat wanting to come in now.
Thank you, Chair. Yes, I just wanted to give some assurance to the committee that the Quality, Patient and Safety Committee has, over the last 6 months in particular, given an awful lot of focus on care homes, along with our colleagues at the Joint Commissioning Unit. So it was heartening to see the local wraparound support that's gone into the care homes within South Tyneside, and I would like to say a big thank you to everyone for that. And I think the thing about, for me, and it's really leading into the next paper, is that learning from. And as part of that learning from, I'd just like to get some assurance, please, from everyone. And you have mentioned this, and it is mentioned in the next report, but I think that sort of learning needs to include that feedback from the care homes and residents and families of those residents themselves. I guess let's anticipate that we do that.
I think that's a very good point, Pat, and making sure that we listen to people as well as professionals is going to be really important, and maybe we can touch on that in the moving forward report, Matt. Neil,
Chair,
I think.
Chair, can I just finish, because there was just one other important thing for me as a lay member, and that is that we've heard a lot about the the impact on the most vulnerable in our area. And so it was good to see, and the importance of working together across the systems. And so it was good to see that under the South Tyneside Alliance partnership working, that's the approach that we've given to that. And I think that what I've seen in that report is the outcomes of that, the benefits of that focus. So I just wanted to say thank you to everybody for that focus.
Thanks very much for that. I think Neil wants to come in, and then maybe if Neil wants to wrap it up before we move on to the next. Matt wants to finish.
Sorry, very quickly, Pat, I think your camera is still off. Just a minor thing.
Okay, Neil.
Just a very kind of point.
Sorry, very quiet, Neil, again.
Sorry, I'll get closer. A brief point from myself. As we, as a group of medical professionals, learn more about how COVID behaves, which patient groups are most vulnerable, how best to care for them, the strategy of how nationally we manage them will evolve. We, at the outset of this, we were very much planning for, the unknown, really. We all saw the pictures from Italy, and we absolutely did not want that for our population. But as now we understand how this disease spreads, we've got lockdown measures in place, I would be, we'd be foolish not to adapt the strategy and how we manage these patients and where we manage these patients as time progresses. So I accept your comments, and I think it's understanding why decisions were made at a point in time. But what would be foolish would be that if we did not respond to our increased knowledge of the disease as we go forward.
Thank you very much, Neil. Okay, I don't think anybody else has wanted to comment on that paper. Can I thank you, Matt, from the team for that really excellent summary of an awful lot of hard work down the last couple of months, and we will no doubt not see the last of this. There will be more papers on similar lines in coming meetings. But thank you very much for putting that all together. That's been a really, really helpful summary. Perhaps we now need to move on to shaping the future, or the new normal, and how we learn and move on. And there's a second paper there.
Yeah, you're going to get very sick of the sound of my voice, I'm afraid, by the end of today. I think what I'm going to do is just take you through the executive summary and then pull in the bullet points which are on page 6 or 7, rather than going through the whole paper and perhaps open it to questions. We've titled this, we took some time thinking about how to entitle this paper. So we called it Shaping Our New Future. Now, there might be other ways of framing it, but I didn't particularly want to call it Recovery. I think we've mentioned this a few times during the meeting, but actually, we're going to have to think about how the world moves on in a different way. There's some fantastic things that have happened in the last couple of months in how our agencies work together to support people, and we need to capture those and make sure we make the best of them. And we have to think about how we come out of this well, and how we adapt to live with COVID in our lives over the next few years. So this paper really is intended to set out our thinking about the approach to that recovery planning, to that planning for shaping a new future. So we're proactively starting to think about the stages we need to go through. We need to establish that new normal. And as I said in the paper, rather than recreating business as usual, we really do want to learn some of the lessons. So we really do want to think about, for example, actually, if we have outpatient clinics where patients are going to see several different consultants on several different days with several different sets of blood tests, I don't think people are going to want to do that particularly moving forward. We need to think about how we capture the technology and the change in behaviour of our patients, to think about how we support them through multi-morbidity clinics or through other mechanisms, for example. In terms of how we're going to coordinate this, we're establishing the South Tyneside Recovery Coordination Group with, as you'd expect, the South Tyneside partners from across the system, including the third sector, and that will be responsible for coordination of the recovery plan. It'll be accountable to the Alliance Business Group, which obviously feeds into the Health and Wellbeing Board, and there'll be direct reporting into the CCG Executive Committee and hence into this governing body. And I know that governing body members will be extremely interested on keeping a close watch on this moving forward. There are a number of layers we need to consider when we think about our planning for the next stages. So we have to think about the CCG as an organisation in its own right, how we support our staff, what we're going to do about the working of the functioning of the organisation moving forward. We need to think about the health and care aspects of the system, so how we think about what the NHS is doing, how it's interacting with social care. But we also have to think about, importantly, the broader aspects of health well-being. How do we acknowledge that many people that will have lived in an isolated way for a long period of time, there may be some serious economic consequences, and those we know have serious impacts on people's health. So we've got to think more broadly as well. So in taking the recovery plan forward, we are using what we're calling the 4 L's framework, identifying what people liked, loathed, learned and longed for during this period. And we're capturing that learning systematically. We are capturing that learning from individual organisations, from GPs, from the CCG, from social care, but also across multidisciplinary groups, such as through the Alliance leadership team, through our individual alliances. And we're also trying to seek the views of patients, care homes, and of our community. So our third sector colleagues have been really helpful in making sure we get that broader view of what our patients felt and what our residents felt during this period. We're anticipating taking an outline of a recovery plan to the Health Wellbeing Board next week and to the Executive Committee next week. So I haven't actually set out much of the bones of the likely recovery plan in this report, other than, as I say, on page 6 or 7 of the report you've got in front of you, which is page 39 of the pack. So I might just draw you down to those bullet points if that's okay before I close. I've lost them myself. So bottom of page 6, top of page 7. So some of the things that we think likely to be important. So the ongoing impact of COVID-19. So we've talked about the risk of further peaks, the rehabilitation of patients who currently have COVID, the testing and tracing, PPE availability as we move forward. And obviously, as we start to change the estate to deal with different infection control practice, that will have an impact on capacity in the system. Really retaining those positive changes. I'm determined that we don't lose some of the positives from this period of change, like video consultation, agile working. We've got workforce considerations. I think working with us and supporting communities, our volunteers in South Tyneside have been quite fantastic, really brilliant. We've seen immense civic pride and commitment with people adhering really well in South Tyneside to the guidance about staying home and making sure that people social distance. So we really need to capitalise and build on that. We've talked a lot about the most vulnerable people in our society. We know, as we said, the impact of COVID is unequal, so we will be focusing unequally on the most vulnerable. Public health and prevention and the wider determinants of health. So what is the impact of school closures for that period of time, of poverty, housing, of potential unemployment? And we will be working through that as a system. The impact on patient care. So as an NHS organisation, we might first focus on delayed presentation, diagnostic availability, elective waiting lists, and so on. I think that is one part of the plank of the recovery plan that we will be presenting in the weeks ahead. And we really do need to think, and I've had some conversation with some of our governing body members about our communications, both internally and externally, and how we make sure we use those in a more strategic way. I don't really want to go through any more of the paper than that, if that's okay. I thought it was worth just setting out a bit of the structure and picking out some of those bullet points which I feel likely to form the bones of the paper. And I just ask the governing body to note that, if that's okay.
Thanks very much, Matt. Questions and comments? I think Jeanette.
Thanks, Chair. I just thank you for the paper, Matt. In terms of the membership of the group that's been established, the Recovery Coordination Group, I just wanted to make a request that we include representation from the designated safeguarding team. I think it's really important that we have that representation at this committee from the outset. Sorry, I've got feedback. From the outset, and I know that they would value the opportunity to be involved.
I can completely agree, and they certainly weren't excluded deliberately. So very, very happy to include that team. I think as we've talked about, the safeguarding concerns, our looked after children, are a key area of focus. So yes, absolutely, not a problem.
Paul?
Yeah, Mark, it's great to see the word recovery and the fact that we're looking at it and planning it. And I think some really good stuff that's come out of this pandemic, if I can say that. And I'm particularly thinking about digital platforms and e-consultations of GPs that we need to build on and continue. The other bit is around about patients. We need, so just before the pandemic broke, I wrote to Tom about the Dementia Alliance. I know that's on a piece of paper somewhere, but we really need to bed this Dementia Alliance in, because not only the people with dementia are struggling, but their carers are. So I'd like to see some of that in there as well in the recovery.
Sorry, I was on mute. Yeah, absolutely.
I'm going to lip read, Matthew, because you're on mute as well.
It was Kate and then Tom.
It was just an observation really about mental health services and the potential additionality that we're going to need going forward around things like bereavement counselling, post-traumatic stress disorder from staff potentially, and also an observation from colleagues in the mental health trust that, you know, for them surge is coming. So I suppose just we need to have that in our radar as well.
Thank you. Tom, did you want to come in?
Yeah, I mean, it's a broader point really. I mean, I think that the work we've done so far to reflect has been really helpful. I think there's thinking about recovery point has to be broader than just say the next 6 months or the next year. And I think I made this point earlier in the meeting. I heard someone from the World Health Organization and Andrew Marr on Sunday talking about we need to get used to this for the next 5 years. And I think with our conversations as a health and wellbeing board next week, we need to think about how does this shape our place-based strategy going forward as a borough. If we're facing the biggest economic slump in Britain's history, it's going to fundamentally shape our communities. So we're going to have to think not just about how we deliver health and care, but how do we shape our society as a place. And so it needs to be a bit of and both. We need to deliver services, but we also need to think about how we work with our communities and how we shape our communities from here.
Yeah. Okay. Thanks very much. Thanks everyone for your contributions and your comments there. So I think we're from the comments, Mike, I think you can take it as read that the governing body endorsed the approach laid out and are very keen to crack on with the detail of the plan once it's as it develops. So again, I'm sure this won't be the last we see of this this item on our agendas. Thanks very much, and I think you have the endorsement that you seek. Let's move on through the agenda then. The next item on my list is the finance section and financial management during the pandemic. So over to you, Kate.
Okay, thank you. And apologies if I look like I'm not looking at the screen. I'm just trying to read my notes at the same time. Just to update you all, the NHS England have put in place a revised financial framework for the period of the pandemic, and that's certainly going to be in place until the end of July, although the anticipation is that that will be extended until certainly the end of September. Within that, the national team have given CCG's revised allocations and have now instructed us to upload our budgets up to month 4. So this is why we haven't been able to do a budget paper yet, because we're sort of working within this ever-moving financial framework that comes out usually after the effect. So the expectation is that CCGs will break even and we will get our allocations adjusted non-recurrently to that effect. So we are at the moment logging all the costs associated with COVID with the expectation that they will be reimbursed on a non-recurrent basis to make sure that the CCG breaks even. What was I going to say? The allocations have been adjusted for a couple of known national issues. So one's category M pricing on drugs, which will be adjusted from June, and the other is 2% increase on funded nursing care that has been agreed nationally as well. So the allocation has been adjusted for that, and it's also being calculated on the basis of our expenditure in the last financial year. So block contracts have been agreed for our main providers. For all other areas, the allocation is based on our average monthly expenditure from last year. I suppose just to flag that within those block contract arrangements, they've taken the month 11 position and they haven't adjusted it for any non-recurrent expenditure that went in. So for example, for South Tyneside and Sunderland, we had given them some non-recurrent support last year. That's still factored into the block arrangements for this year, so we'll have to do some sort of reconciliation and wash up on that. But I'm in conversation with the trust about that. And also just to flag that we have been given additional allocations to work to for ourselves as the local authority, and we're working closely with them around the additional COVID costs. That's all I was going to flag up, really.
Thanks very much, Kate. Any questions or comments? John, anything specific to add there? And then, yeah.
Sorry. Is it all right?
John and then Jeanette.
It's just it's something that I would like to discuss probably offline or at a future audit committee with Kate, is about sort of monitoring the monitoring process of the additional expenditure and looking at sort of how much additional money we have actually spent this year.
It's absolutely fine, John. I can share the return with you that went in if you'd like to see that.
Thank you.
Great. And then I think Jeanette wanted to come in as well.
Yes, please. Thank you, Chair. On page 18, Kate, you've got your wheel with the pie chart, with the breakdown of spending. And I know in previous years we've talked about the proportional shift or not around the sections where the spend is. And it looks very much the same, I think, as it has been on previous years. But the point that I had wanted to make was, in light of what we know now, we've always been an organisation that's been focused on trying to tackle inequalities. But I think COVID's brought that even in more sharp focus, because we know that it disproportionately is affecting people who are also deprived, disadvantaged. So I just wanted to really point out that this is an absolutely probably once in a lifetime opportunity to seize that gauntlet now in terms of where we need to focus our attention going forward. And difficult decisions, but it's closing that inequalities gap, which is really important.
I think just for clarity, I think what you're referring to is the annual report, Jeanette, which is further down the agenda, which is fine. No, it's absolutely fine. I think you're right. I mean, we have absolutely focused in the past on shifting that pie chart, haven't we? We've had many conversations about the secondary care sector needs to reduce, and the community and mental health and all the other bits need to expand. So yes, I think you're right. This is an opportunity, but I also think making investment decisions while we're working under this revised financial framework are going to be really tricky. So again, it's how do we manage that going forward? Yeah, it will be as with many things, it will be a balancing act, won't it? I guess in the months to come. So thanks for the report, Kate. We'll note the reasons for the lack of formal budget so far and the uncertainty, some of the uncertainty, but the assurances that the COVID will cover things. Yeah, I suppose just to finish that off, it's so that there won't be a revised final budget coming at any time soon. We've got the draft budget that was balanced. We've got to work within the new financial framework. We've been given assurance at this stage about it being we will be reimbursed, and I would assume around about, if not the end of July, then September I can bring something back. Okay, so we'll expect to see something in September then, if not July. Great. Let's move on then to Public Health Report and Health and Wellbeing Update. Tom, it must be music to your ears that we've had people interrupting a finance report to talk about health inequalities and how we can improve those going forwards. But you get the chance to say it again now.
No, that's excellent. It's what I've come to expect from South Tyneside. I think we've got an excellent perspective on what really matters as a system in South Tyneside. So it's always pleasing to hear it, though. Just a verbal from me, Chair. I think it's probably worth saying that a lot of what was in the two reports that Matt presented represents our current place-based picture. I think it was both excellent reports, and I think Matt did a sterling job, in fact, of presenting the statistics and making sense of them, probably better than a lot of other people I've heard try to do that. So I just wanted to say that I think Matt's covered it off really well in terms of our local picture in relation to COVID. I just wanted to say that although COVID has put pay to the formal public meetings of the Health and Wellbeing Board during this period, the board has still continued to operate its strategic convening role, albeit in private, and getting together our key partners as a system to make sure that we're all joined up on our COVID response. and the board's coming together again next week just to check in and sense check progress, and also turn its attention towards the new future and what we've learned through the COVID process. Just to say a few things about that broader partnership response, because I think, again, Matt's covered it off really well in terms of health and care. But just in terms of that broader partnership response, we're starting to turn our attention as a council to how we safely restart certain services. You've probably seen a lot of that in the press in terms of things like the recycling village opening and opening the car parks at the seafront, all done with a heavy emphasis on risk assessment and trying to line up with government guidance around those particular issues. So we want to move to the future as we ease the lockdown measures, but paying particular attention to avoiding a second spike of infections and also managing the situation that we've got at this present time. Mike Conlon, as the corporate director for Children's, Adults and Health, has been working very closely with the schools on the school reopening procedures. He's written alongside Councillor Moira Smith to all parents and carers, and they should be receiving that letter in the next day or so, just emphasising that we're taking a cautious approach to this and supporting schools as much as possible to risk assess and make their own judgments on what they're able to do from the 1st of June. Obviously, it's heavily dependent on how the pandemic continues to progress and whether we can meet the 5 tests that the government have outlined. So we'll continue to pay very close attention to that and support the schools to risk assess and move to opening further if they can within the current restrictions. It's probably worth emphasising that the schools obviously have been open throughout this period of time to support our key worker populations and those children who have additional vulnerabilities, and the schools have done a fantastic job in doing that, and just want to add our extra thanks to them for what they've done through this period of time. We've talked a lot about care homes, and Vicky might want to come in after I've finished around the Adult Social Care Action Plan. The Health and Wellbeing Board will be considering that in draft next week before it's officially submitted to government. But again, that's a true partnership effort, but just formalises the work that we've already been doing as a borough. As Vicky said, we were arguably ahead of the curve on this, but the Adult Social Care Action Plan just formalises it in a return to the national government. You may have seen that the testing strategy has continued to evolve, and Matt's already pointed out how that's impacted on our local figures, and indeed how certain sections of testing aren't even included in our local figures or the national figures. That is the Pillar 2 testing is not included in those figures. But the testing strategies continue to evolve. We've now got whole care home testing available. That's for symptomatic and asymptomatic individuals. The symptomatic testing has also now been expanded to anyone who's aged over 5. So that's available to the general public now, as well as key workers. So that was announced earlier this week. So as we expand testing, as Matt already pointed out, if you expand testing, you potentially find more cases. But it will allow us to, as we ease restrictions, keep a closer eye on what's happening in communities, but also support particular hotspot areas if we're starting to see outbreaks forming, and we can provide additional support towards that. Going hand in glove with that, you've probably heard the announcements around contact tracing and our move back towards a contact tracing strategy. We understand that that's likely to come online next week. And again, as a system, we'll have a key role working with Public Health England to be able to support the contact tracing arrangements, but we'll know more on that officially next week. And of course, we've already talked about it really, which is the learning lessons from now and turning our attention to the new future. I think it's really important that the Health and Wellbeing Board does that at the strategic level as well, supporting a lot of the work that's been happening at the alliancing level in the various alliances we've got as a system. So that'll be a key focus of next week's conversation. And I think I'll just leave it there, Chair.
Thanks very much, Tom. I think Vicky, you wanted to come in as well.
Yeah, just to add into Tom's point around that we do, from a local authorities perspective have to submit next Friday, so Friday the 29th, our assurance plans around the care home support plan. That has to be done from our Chief Executive, Martin Swale, so he needs to submit that plan, but it does have to be done in conjunction with the CCG. So obviously it's from a partnership perspective, and it's looking at a range of different areas, so infection control, testing, support for our care homes, PPE support. We do have to provide a letter setting out what support we've done to the care homes. There's an assurance template that we have to complete, and as I say, we're working through that currently, and that will be submitted by the 29th of May. Just in terms of adult social care generally, we have seen a reduced level of activity that's starting to pick up over the last week or so, and I know Jeanette's already referenced it, but yes, we are mindful of the reduced activity in adult safeguarding as well, and we're working with partners around preparing for what we're expecting to be an increase, and how we can raise awareness around safeguarding really with the Safeguarding Adults Board, and just preparing for that.
Thank you very much. I think Paul wants to come in with a comment or a question before we move on. Paul?
Yeah, just a question for Tom. Tom, you're the Director of Public Health, and I just wanted to run something past you. Well, we've learned today the excellent work that volunteers have been doing in the borough from Matt, and I'm particularly looking at external communications with the public around the theme of health. And I think we're lacking in some of that, because most of the information we can find is either the National Briefing or ONS, Office of National Statistics, things that you've just talked about. And we're doing it now, aren't we? We're live streaming our very first public live stream of a governing body meeting. That's just one channel. But what other channels can we use to start giving information out to the public and engaging the public?
Tom?
Yeah. I think that's a fair question, Paul. I mean, I think I've actually been quite bowled over about how the public's responded to our different communication channels through this period of time. I've done 3 Facebook videos now, which are available on the council's website. I will leave you to watch those at your leisure. But I'm quite bowled over by the number of views that those kind of videos have received. I think the first one was over 31,000, but obviously that was when we were in the very early phases of the COVID outbreak, and subsequent videos have received around about 4,000 views. That's a much wider reach than we've ever seen before in terms of public messaging, and I think there's a lot we can learn from that and how we follow that up. The council had its second live stream cabinet meeting last night. The first one 2 weeks ago featured a lengthy overview from myself as well. Again, that was live streamed on YouTube and got a significant number of viewers as well. So I think using these different comms platforms have been really, really well received through this period of time. And we've continued to use our regular comms channels such as Facebook, Twitter for some more of the static messaging rather than just the videos as well. So I think there's been a lot come out nationally, I would agree, but we have tried to tweak and do our own bespoke stuff locally as well, which seems to have resonated pretty well with members of the public.
Thanks very much for that, Tom. I think Matt maybe wants to come in with final communications.
Yeah. And just briefly on that point, I think there is something about recognising that in getting some of those messages out, the council and the FT are almost the bigger, more kind of publicly, they have a kind of bigger reach, I guess, in terms of public interest. So what we've been trying to do is behind the scenes make sure all those messages are stitched together, so that between the CCG, the council and the FTs, those messages go out as one package. But often that's not necessarily directly out through the CCG, it's through our partners.
Okay, that's great. Thanks very much for that. Let's move on. Let's note the report, Tom and Vicky, and the work that's ongoing there. We do have the time of the year. There's various statutory governance things that need to be done. First of those being the sign off the annual reports and the financial statements of the last financial year, which feels like an awful long way away now. Kate, are you going to take this item first and do it as a two-piece between you and Matt?
Yeah, that's absolutely fine. Just so people are aware, Mark Outerside from Mazars, and Cameron Waddell are just joining us, so I'll just give them 2 seconds to make sure they're here. I haven't seen their names pop up yet. Okay, so the annual report and accounts went to the Audit and Risk Committee last Friday, which was the 15th of May, and that's the version that you see in your pack here. At that meeting, they were approved for submission to the governing body for further submission to NHS England. Things have moved on in the last few days. There have been a couple of amendments to the accounts that I just wanted to flag with you, and that have been agreed with Audit Risk Committee. To be honest, most of the presentation issues, so I won't go over those. But the 2 key things really for me are around the prescribing accrual, which was amended because we had included 2 months of prescribing accrual, whereas we can include the February actual and just an accrual for March. So we've made that amendment around notes 1.172 and note 9. And another minor amendment that we've made is around, we hadn't included the mental health investment standard audit expenditure in the correct place. So on note 5, that's now been included and flagged as £11,000, and that's been moved from the purchase of non-NHS healthcare to other non-statutory audit expenditure. And I think those are the main changes. The rest have been around wording and things like that, but they're the sort of substantial financial changes. They've been agreed with our audit colleagues, and I'll let them comment on that. Just one other item I wanted to flag was actually 2 things. One around note the related party transactions. We found out, or we realised quite late, that we've missed 2 related party transactions out of the note. So we'll need to amend those. And my proposal will be that we include them, and they are for Warren Street Surgery, where Matthew is a partner, and for South Tyneside Healthcare Collaboration, where Drs. Gordon and Walmsley their practices are involved. So we need just to make sure we disclose those related party transactions. Colleagues are next in the process of making those amendments, and my proposal would be that if we're able to today, we approve the accounts subject to those amendments, and then the Audit and Risk Committee receive those next week and sign those off for onward submission to NHS England if members are comfortable with that. Yeah, I'm seeing a nod from John. Pat, Paul, are you okay with that? Yeah, nods, great, okay. In terms of the annual report, I'll let Matt speak about that a little bit more, but just to flag that within the annual governance statement, we haven't yet received the third-party assurance and payroll. So again, I'll either amend the AGS next week and I'll let Audit and Risk Committee see that, or hopefully we should receive it within the week and we'll be able to complete that.
Thank you, Matt.
Yeah, so I'll cover the annual report fairly briefly, if I may, and I think I'll start with an apology. So we set out with an aspiration to approach the annual report very differently this year. We really intended to set out a much more user-friendly, interactive, patient and resident oriented annual report, and unfortunately we were rather stymied by capacity and time during the COVID response, so we've not been able to do that. But you have my commitment that for next year the annual report will have a much more all singing all dancing feel to it. Clearly there's a number of statutory requirements we have to meet in the placing us by NHS England and getting the annual report approved. So therefore, I personally tend to focus on the first 20 pages or so. That's where the meat of the activity is, around the actual healthcare wellbeing activity that's taken place in the borough. So there's an emphasis on our long-term conditions work, the work on learning disabilities, such as the assertive outreach team, which is on page 12, the hubs, and you've got the children and young people's mental health, frailty and cancer, some of the end-of-life co-design work we've been doing. I did just want to pause on page 15 and 16, which talks about the path to excellence work that's happened in 1920. So the implementation of the changes around maternity and so on, and also the Court of Appeal finding successfully in the NHS's favour. And finally, moving on to phase 2. And I think it probably would be remiss of me not to mention the engaging people and community section, which is pages 25 to 30. Where Paul Cuskin and Helen Ruffle and the teams have done a huge amount of work on how we approach our engagement. I think what's different about South Tyneside is that engagement work is not just the CCG, it's us with our partners, so that you'll see in there's reference to all the work with Joint Commissioning Unit, very different work about engaging learning disabilities really impressive piece of work, I think, around the autism hub that was established this year. So I think it's, if I could draw your attention to any sections, it would be from page 10 to 15 on those elements of substance, and the engaging people in community section on pages 25 and 30. For next year, we'll be looking at something that's much more interactive and that gives a South Tyneside Alliance annual report with inclusions of the Director of Public Health report, the Council report, and some work with the FT. But I'm afraid that will be next year.
I think the reasons are quite obvious. So could I ask just for very brief comments from John as the audit capacity, since the accounts are going through here. I think Paul wants to come in, and then we'll finish off with Neil as accountable officer. Your signature will have to go on the bottom of this, so it's only right that you have the final say on this matter. So John, then Paul, then Neil.
First of all, I accept Matt's comments, but there's a lot of hard work goes into this, and I'd like to thank colleagues at the CCG and at Next for the work in producing these two pieces of information. As Kate said, we looked at the audit committee, we went through the accounts in detail, we made suggestions to changing the annual report, and I'm sure they'll be picked up. I think you'll be subsequently hearing from our external audit colleagues about their position, which was positive last week, and I have no particular issues other than to recognise that it's been a straightforward process, and that's again testament to everybody's involvement, especially this year.
Thanks, John. Paul?
Yeah, just very quickly, thank you, Matt, for the shout out, and it would be remiss of us not to include Jane Layton in that. It seems like a long time ago we had a quite a controversial event, the Death Cafe, back in, I think it was end of last year, am I right in thinking, beginning of this year, which was very well attended, very well received. So thank you to Jane for that. And just to volunteer, if or when we're going to do next year's annual report, if I can be of help as a layperson, just to look at a different perspective, then please, include us in that.
Okay, thanks very much, Paul. And Neil, finally.
Yeah, thank you. Yeah, I mean, it's obviously to look back in the year that I wasn't involved with, but I have obviously been involved in the process of signing this off. On page 44, there's the statement of the accountable officer's responsibilities, and I can confirm that I've got absolutely no concerns on how the accounts were drawn up, that the CCG is an ongoing concern, and that there is nothing that I'm aware of that's not within this report that should be. So I'm happy to sign it off.
Thank you very much. So we will note the assurance given by Neil, by John, by the loops that this report has already had and the scrutiny it's already had. We'll note the few changes to be made between the current draft and the final version to be submitted, as Kate has told us, and agree that subject to those changes can be submitted to NHS England on behalf of the organisation. Kate, is there anything that I've missed out that we need to formally do for you for this?
No, I think that's fine, thank you. And just while I'm off mute, just to reassure John that we've amended the annual report in line with some of the comments that he'd made.
Okay, that's great. Thanks very much for the work that went into that, and we'll note the aspiration, or the firm commitment rather than aspiration, I think that was, Matt, to have a slightly different looking report next year. Okay, let's move on then to the audit completion letter, and I think that Cameron Well has joined us within the meeting. So Cameron, if you could turn your microphone off mute and take us through the enclosure that you've sent.
Thanks, Chair. Morning, everyone. How much do you want in terms of detail, Chair, given much of it's already been through the audit committee? Would you like me just to focus on the absolutely key messages?
I think that would be perfect.
I'll do that. So we obviously reported to the audit committee on Friday, and not a huge amount has changed since then, apart from we're a bit further on in terms of completion of the audit. Kate's broadly already outlined the little bits and pieces that have been amended since Friday. And as she pointed out, those are to do with disclosures and notes within the statements themselves. There's been no changes to any of the underlying numbers in the core statements. and nothing that would impact adversely on your delivery of your statutory financial targets, which are at the back of the accounts. We have noted in the report a small difference between the March prescribing figures, between the accrual you did have in your draft accounts and the actual. It's £158,000. It doesn't have an impact on your surplus in terms of moving you to a deficit. Therefore, we report that because we feel we have to do so, but not something we would expect the CCG to amend. And that's reflected in the opinion we're proposing, which is unqualified, which I think I said in the audit committee and then got told audit can never be remarkable. But I still think it's slightly remarkable that despite everything that's going on, the CCG with NEX have managed to produce a set of accounts very close to last year's deadline, and the audit is broadly finished in line with that deadline as well. So from our point of view, we'd like to thank NEX and the CCG to help facilitate that, because it's been slightly odd doing everything remotely this year. The other things just to point out, Chair, are that we're proposing an unqualified VFM conclusion in light of things like the CCG's financial performance and some of the things I heard you touch on earlier around about working arrangements with the local authority, the FT and other CCGs in your vicinity, amongst others. And also we have unlikely to be reporting anything significant in terms of the consolidation schedules with NEO, but we still got to finish that work. As Kate's pointed out, we're waiting on the ESR report, which we'd quite like to have before we sign off. We're not absolutely sure timetable, but we're expecting it sometime in the next few days. Beyond that, we're expecting to get everything signed, sealed, dusted, delivered and submitted probably in the next week. Does that sound reasonable? The appendices to the report, three key ones really are the management rep letter, which we obviously need back from the CCG, and we need that dated ideally on the day we're going to sign off. So we'll liaise with Kate about doing that in terms of signing and dates. But it is very unremarkable, so we're not asking for anything unusual. It's a bulk standard rep letter. You should be asking us questions if we're asking you for non-standard representations, but we're not. The auditor's report there as well. It's not exactly the most riveting read, but it's the thing we sign at the end that says everything's okay or not. And you'll see that that's unqualified in all respects, nothing to report. And finally, there is an appendix in there around about independence. The only thing we need to draw to your attention is we are now the service auditor of Capita. We're aware that that one's late because basically COVID-19 stopped the programme of testing when it was due to take place at Capita. What we have done, though, Chair, is we have obtained the scope of that work and just made sure there's nothing in that scope that would give us pause for thought in terms of the way we actually tested the CCG's accounts, and there isn't, because we'd always decided to apply our own testing strategy and not rely on that report. And we're liaising with Kate around about formal words for that for the AGS. Beyond that, happy to take any questions, but all things considered, really getting to the state we're at on the 21st of May is amazing, really, I think, this year.
Yeah, I'd agree.
Oh, with so few reporting points, I should have had.
Yes, both remarkable in two ways. So thanks very much to the whole team that's been involved in delivering that, not just the timeliness of the completion of the audit, but the work throughout the year, which leads to the lack of points and qualifications to the accounts at this stage. So both are quite remarkable. Can I ask colleagues if you've got any comments or questions for Cameron at this point? I see no microphones being turned off, so it looks like you've got everything covered. Thank you very much, Cameron. Thank you, Kate and the team for that. And we shall await the final sign-off. I presume there are ways to do this with usually each year it involves a scurrying round of sort of fountain pens on bits of paper at the right time.
I think the first time ever in my career auditing the NHS, there's been a degree of pragmatism applied to how you actually go about signing things. So I don't think we don't seem to be going through you must use non-black ink, and it's got to be signed with wet ink, and it's got to be, as you say, ferried back and forward. Our understanding that things can be done electronically at your end, and we've agreed with Kate, she'll scan a set of those through to us with the signatures. We'll sign them off and send them back through again.
Maybe that's something we'll want to keep going forward today.
Indeed, it would be quite helpful.
Okay, Kate, want to make a final comment?
Yeah, just thanks to the team, to Mark and the team. Very easy audit, to be honest.
Yeah, I agree with that. So we'll thank everybody, accept the letter, and the work that's gone on will be noted. Thanks very much. Okay, let's move on.
Thanks, Chair. I'll take my leave now and go off and sign files off. Bye for now.
Bye bye. Good to see the Alps in the background as well.
Well, it is a bit cold, but you know.
Okay, let's move on. The next item is the risk management report, and I think Matt, you're going to bring that.
Yeah, and I'm not going to go through this in depth, but just to say, so in line with our approach to risk management, we bring extreme high and moderate risks to the governing body 3 times a year. You'll see from the body of the report that there are no extreme risks currently, or at least in the residual risk status. So we're asking the governing body to consider the risks that face the CCG and their assessment. They're set out in detail in the paper, and review any actions accordingly. I would just draw your attention to page 5 of the report, which sets out risks that have been closed during the period since the last report was brought, and risks that have been opened. And you'll see the risk that's been closed relates to failure to achieve quality premium trajectories because the quality premium no longer exists. So it's not something that is a financial risk to the organisation in that sense. The removal of the quality premium is unfortunate for the CCG, given we in the last couple of years have performed really well against it, with reductions in A&E attendances, non-elective admissions and so on, improvement in cancer, stroke and other areas, but that is as it is. And there are a number of risks that we've added relating to COVID. We have sought to be consistent with neighbouring CCGs about how we reflect the risks, and those are the ones we've established so far. Between Helen and I, will be thinking about whether those are a proper reflection of the situation as it moves forward, because obviously things have been developing pretty quickly, so maybe we need to just flex those slightly. So that's really all I wanted to cover at this point.
Okay, thanks very much, Matt. Any questions or comments from those around the table? I'm thinking specifically of new members, so Neil in particular, in terms of holding risks. You've got to be comfortable as the accountable officer that these are being managed appropriately. So that's for a brief point from Neil, and then I think Pat wants to come in as well.
Yes.
So yeah, I'm happy with it, and I mean, obviously the COVID was added to the risk register, and that's, you would expect that to be our highest risk at the moment. But yes, I'm happy it's all being managed well.
Pat?
Thank you, Chair. I just wanted to confirm that Jeanette said that we were going to add a risk around safeguarding under COVID.
Okay, so it's a dynamic documents that I'm sure will be added imminently.
Yeah, it's particularly with the focus on the recovery phase and what risks we're anticipating we might face.
If I may, Matthew, I think what we will do is say we've been adding risks, trying to be consistent with other CCGs, but adding risks through this period. I think we will have a bit of a stock take about whether we have appropriately reflected the various risks around COVID. So, as Neil says, there should be some very high residual risks for some of these, and the need to include safeguarding and our vulnerable population. So we will, I'll take that as an action with Helen Ruffle. We'll pick that up before the next meeting.
Thanks very much there. Helen, your mic's gone off. Does that mean you want to come in there at any point?
Yes, if I can, please. I've just had some correspondence with Liz Durham, who is our risk officer from NEX, and she's wanting to do a review of all the risks on the risk register with risk owners. And as you know, in the past, we've had assurance framework workshops, and the last one was stood down because of COVID, but I'm now looking to get that into the diaries and do that via Teams. And hopefully then we can also look at all the risks as well as the assurance framework risks, and that might be quite a useful way of doing it, or all in one go kind of thing, asking people to come in at certain times.
Okay, that sounds like a useful way forward and a way of flexibly managing this aspect of our business during the pandemic and beyond indeed. Okay, thanks very much for the report. We'll note that, and that the governing body is comfortable that the risks are both declared and being managed appropriately. Okay, we'll move on then to the next item, which is the Registers of Interest review. And I think this is down with Keith's name on it. Keith, are you hanging out in the background, very quiet for this meeting so far, to take this this item?
Hanging about in the background, yeah. Thanks, Matthew. So this is just simply to report the update to the Register of Interests. Helen has very helpfully in this period managed to get people to respond and to update their interests. So this reflects the updates as at April, and we'll report it again, obviously, at sort of 6 monthly intervals. But it's fairly comprehensive. There have been some comings and goings, as we all know, in relation to the governing body. So this reflects in particular, the comings. So it's very helpful that people have responded in a timely fashion.
Thanks very much. I'm not sure that there's anything to do in terms of comments and questions around that. It is what it is, but it's a really important document that we need to be aware of, and every time we see it, must make the comment that people should update it should anything change. It's a dynamic document. It changes when people do realise they have any new interest. Let's say
it'll go on the website.
Yeah. Okay, and Kate, you wanted to come in there as well?
Yeah, it was just to say it would be helpful to share it with chairs of various committees so that when they go through their agenda setting, they have the most recent version of the register so they can cross-reference.
Yeah, that's important that we get that flow of whenever it's changed, it goes to a chair, and it comes as part of the package of papers that comes out from the corporate office when we're doing agenda setting for each committee. The up-to-date version does need to come out at that point. And I'm sure we will make sure we continue to work on that. Okay, great. So we'll note the register at its current point, and its importance as a key document within the organisation. The next item is the terms of reference of the Northern CCG Joint Committee. I think, Neil, this has got your name down to talk to us about these.
Yes, thank you, Chair. So this is the kind of annual tidy up of the Joint Committee terms of reference here for your agreement. As you know, the Joint Committee is a joint committee of the governing bodies of all the CCGs in Cumbria and the North East. There in the papers there, we've just highlighted some of the changes, which I don't think are that substantial. You'll see that there is the intention to carry on with lay members on the joint committee, which I think is good governance. Yes, it's just here for your information and agreement, hopefully. I don't think there's any big material changes there, to be honest.
Okay, that's great. Anybody got any comments or questions they feel need to be raised on that at this point? Click down. Nobody. Microphone going off wanting to talk. Nope. So we will take that as the changes agreed to be adopted by the governing body. That's very helpful. Thank you very much. Oops. And the next, as we usually do, we have a suite of various subcommittee minutes. I know that from the publicly available papers, some of the minutes of the Quality Committee needed to be pulled briefly and then will be republished again. I think, is that correct, Matt?
Yes, Chair.
Okay.
We will be putting them up again soon.
Okay, that's great. Thanks very much. Does anybody have any observations, questions, comments from the reading of those minutes that need to be raised at the governing body? You're still off mute. Does that mean there's something more you need to say, or you haven't pressed the mute button yet? Mute button on. Right. No questions or comments then from any of those. We also have the current draft cycle of business for the next year for people's information. Again, if there's anything that people feel needs to change on that, please let me know. We will adapt the business of the governing body as required. Can I ask members if you have any other business that needs to be raised at this meeting? Yeah, Matt?
Just very briefly, thanks to Jane Leighton and the team for supporting this meeting, and we all send our best wishes to Andy Sutton, who would normally be here, but he has had an accident, so he will be back with us soon. But we wish him all the best.
Indeed, it's been great to Andy from the whole team, I'm sure. We do have the final item then as being question time and questions from members of the public. Members of the public have had the opportunity to submit questions to the governing body by email, given they're unable to participate directly in the meeting. We have had one communication from Roger Nettleship on behalf of the Save South Tyneside Hospital campaign via the Unison office at South Tyneside District Hospital, and there are a number of questions. I thought some of the questions asked have been raised by, have been covered by the presentation, and as you might expect, most if not all are about COVID response. So what I'll do is I shall read the questions specifically raised by Roger, and I'll ask Matt, as the director responsible, to either point out if they've been answered already, or give further information if he feels necessary, or indeed or bring in other members of the team if necessary to answer Roger's questions. So, first question I have from Roger is, in view of the high number of deaths, the guidelines and risk assessments at our local hospitals and care homes and community should be far better than government guidelines.
Yeah, and certainly it's not so much a question of this one, but as we talked earlier about the mortality rate, sadly we are in the middle of a global pandemic, and therefore unfortunately there has been mortality, but hopefully the presentation put some context around that would have been useful for members. But we're absolutely following all the guidance nationally, so the public health guidance, infection control, the medical royal colleges, and then many of which is expert and independent of government. So we're certainly adhering to best practice in terms of the guidance that's available.
Again, some of Roger's questions are rather rhetorical. There needs to be a sufficient quantity of the right protective equipment for staff, care homes and community carers.
Yeah, and you can see lots of people nodding around the room, completely agree with that. I think, as we've mentioned earlier, we've worked really hard locally in South Tyneside and across the ICP ICS to make sure we've managed PPE, I think, really well. The Trust have not reported a shortage of PPE to me. I had a conversation with them this morning, and certainly for care homes, for practices, for other members of the healthcare family, health and care family, we've really worked hard to get sufficient PPE.
Okay. We would like to know.
Sorry, just want to add from a care home perspective, that we do phone around the care homes every single day to check their stock levels, and we've been able to furnish them with PPE if and when they've been running short and they've not been able to get it through their usual routes. And Vicky and myself have been writing to the managers on a regular basis to make sure that they're up to date with the latest guidance.
That's good to hear.
I would just add as well, it's not just the care homes, that's all of our domiciliary providers, our mental health support providers, learning disability providers. So I think, yeah, we've done an awful lot of work around PPE across the borough.
Okay, that's good to hear as well. We would like to know, what are the guidelines that are being implemented and what risk assessments have been done throughout South Tyneside and Sunderland, where our patients also go.
Yeah, Jeanette might want to comment on this, but certainly we're satisfied that providers have undertaken the appropriate risk assessments. There's been stringent national guidance about exactly what should happen under any set of circumstances. So we've been following that national guidance and working locally as a partnership to adapt and amend as appropriate.
Jeanette, did you want to make any additional comments? Or
no, I think there's been very robust processes in place, working with partners, and we're confident that guidance has been followed as appropriate. If there's ever been any reason for point of clarity, it's been raised and dealt with immediately. So,
good. The next question from Roger was, according to reports, at least 2 members of staff who have worked in South Tyneside and Sunderland have died of COVID-19 and others have been reported as seriously ill. Have these cases been referred to the Health and Safety Executive by their employers for further investigation?
Yeah, so I have to say, I think that's the responsibility of the FT, and I'm not able to answer that or comment on those individuals. So I'm afraid that's all I can say at this point. But certainly we can raise that question with FT colleagues to respond to Roger in the way they feel appropriate, if that's okay.
That would be a sensible way forward. I missed out a question in terms of the order that Roger had asked them. Have the risk assessments been monitored, checked and reviewed by the CCG and the Health and Wellbeing Board?
We haven't specifically reviewed the risk assessments that have been undertaken by individual organisations. No.
That would, I guess, be a provider responsibility rather than a commissioner responsibility in the system in which we have.
Yes.
There is a question here which didn't actually pose a question but is a question. Do you agree that people are right to oppose the relaxation of measures which contain the outbreak at this time?
I don't really feel I can answer that question, to be honest. I mean, I think we've worked very closely locally to make sure that we followed all the national guidance. I think the people of South Tyneside have responded really well to staying at home, socially distancing, and I think we'd encourage them to continue to be responsible and show the civic commitment they have done to date. I don't think it's appropriate for us to comment on the whether the relaxation of measures is correct.
Yeah, I think none of us are experts in that particular field, so probably you're right not to express public opinions on that matter. People are concerned about the lack of information on ages and ethnicity of the people who have passed away and numbers affecting hospitals, care homes, and the community in Sunderland and South Tyneside. Do we have this information?
So we don't. That's not information we have, but we have national reporting and national review about mortality. The hospital undertakes mortality reviews of those patients who pass away within within the FT. And certainly, I think the key thing for us has been looking at, yes, there are risk factors such as age, such as underlying health conditions, but actually how we use the information strategically to work out whether what we're doing is making a difference and how we move forward. So I don't have that for the specific individuals. We look at the risk factors and the overall mortality. I don't know if Tom wants to comment any further on that.
Yeah, Tom?
I'd just add that those information on ethnicities, ages, all the rest of it are available on the Office of National Statistics website. However, not broken down to local authority level. We don't have access to that level of information. Just it's purely down to small numbers and the ability to report that at a local level. Later down the line, there may well be further compendiums of statistics that we can look at, but we don't get that locally.
So the next question was, if you have that information, can it be provided to the public? And I guess the answer to that has been fairly obvious. That we have that information. And the final question is, if we don't have it, why has it not been collected locally as a priority? Which again, Matt and maybe Tom wants to comment on.
Well, I think Tom's answered that question really. It's the ability to deal sensibly with very small numbers, and obviously we look at the information that we have available to us and make the best decisions we can on what we have. Okay,
well, that's the questions that have been submitted. I do hope anybody watching feels that's been answered suitably. Matt, I think you're trying to attract my attention.
There are two further questions that have come in. I don't know if you've seen those.
No, I haven't seen those. Those haven't landed in my box. Have you got those, Matt?
I do. So the first question, I might ask if Tom and Vicky want to comment on this. It's a question about how we support elderly and dementia patients through the COVID pandemic. So the specific reference to somebody who was newly diagnosed with dementia before COVID and doesn't seem to be getting support. So how do we help people not to fall through the gaps? I don't know whether Tom or Vicky might be able to comment on that one.
Yeah, I'll answer that one then, Matt. So I know our Joint Commissioner team are doing a lot of work with colleagues from CNTW as to how they can continue to work with people with a range of mental health needs, including dementia. And we're also starting to think about what support we can continue to provide, both adults with dementia and their carers as well, and what that needs to look like in the future. Certainly adult social care is still operating as it needs to, and we're looking at different ways of doing that through the use of technology and things, but our services are still there and available. So if we've got the details of the person who submitted that question, we're happy to make contact with them if you would like us to. But services are still available, so we can pick that up as needed.
Okay, thanks very much for that answer, Vicky. And Matt, did you have one follow-up question?
Sorry, I have just had another one that's just come through to me from Healthwatch, which I will try and pick up as well. Apologies, I'm dealing with 2 or 3 different screens here. There's a question or a reflection that came from St Aloysius in St James Parish about whether we, given the health inequalities and in things like child poverty and food banks in the North East, whether the CCG can have any effect on the factors at play in alleviating the root cause of some of these issues and the obvious health implications. And I suppose we've talked about that a bit, in that by working as a partnership with our council colleagues and with colleagues across the NHS broader family, that we can have some impact on those root causes of health inequalities, and how we respond to economic challenges, schooling, housing, employment, education, and we want to continue to do that. I don't know if Tom wants to give a broader view.
I suppose it's worth just reiterating the breadth of our local health and wellbeing strategy and its focus well beyond health and care services, and looking at those wider determinant issues and the root causes that are described in the query. I think obviously through this period of time we've ended up having a much more narrow focus on a particular infectious disease, but as part of our core strategy we need to probably start shifting our attention back to those wider determinant issues.
Thanks very much.
The last 2 questions are out now, Matthew. So this is from Healthwatch in South Tyneside. So firstly, I think it's a question about the paper that was due to come to the governing body about end of life care. And I think we touched upon that earlier in the meeting to say that we will be bringing that paper back in July. We haven't been able to conclude that due to the COVID outbreak. And the second question is what responsibility the Commissioner has in monitoring the consequences of adherence to the government guidelines, so recovery of services and so on. And to be honest, I think we have covered that in the I think we have covered the question in the discussion about the recovery and the shaping the new future from COVID-19. So certainly we are very much focused on that, and there's a paper on it in the agenda pack.
Okay, great. Thanks very much for that. Thanks everybody for your involvement. Thanks for participating in what's been a different style of meeting to one we've usually been used to, but we've been becoming increasingly used to over the last couple of months. We will try and do this again. We will try and ensure we remain as interactive as we can be with the public of South Tyneside as we do these meetings. I hope anybody watching via the internet will appreciate that we are doing what we can here to be as open as we possibly can. Thanks to committee members for allowing us into your various kitchens, spare bedrooms, front rooms, etc. We will be continuing to have brief thoughts and reflections privately. So if I can ask members of the committee, once we cease the in-public formal meeting, to just stay on the line just for some brief reflections on the meeting style and how it's all gone and what we maybe can do better differently next time. We will do that. But for now, thanks very much for your participation. It has been drawn to my attention that the date of the next meeting might not be correct on the agenda pack that was that was sent out. So our apologies for that. But we will be meeting again, but probably not on a Sunday in July. So thanks everybody. Thanks Lee for streaming the meeting. Thanks Jane for hopefully keeping minutes there. Everybody, I think we're due to turn off the stream, but if people can stay on the line, that'd be great.